Good morning, everyone. Hope you can listen to me. Yeah, my audio and video is clear. Yeah.
Yeah.
I'm Sushma. I work for IIM Bangalore Alumni Office. So on behalf of IIM Bangalore Alumni Relations Office, I welcome all of the participants to this session. And as you know, we have with us Mr. Mittal and Ms. Nadira Chaturvedi. And Professor Nadira Chaturvedi, she serves as a co-chair of the Patients for Patient Safety Foundation. As a management consultant, academician, and social entrepreneur, she holds an MBA from the Indian Institute of Management, Ahmedabad, and she has 40 years of experience in the corporate sector. And she's also now she also has served as a professor of business studies and imparting knowledge to the postgraduate MBA students. Yeah. Welcome, ma'am. Welcome to the session. And then we are also with us Mr. Mittal. And sir, Mr. Mittal is a chairman of the Patients for Patient Safety Foundation. He's a former chairman and president of NASSCOM. Currently, he holds the position of several corporations, social and educational institutions. And he's also served in leadership roles at HP, Compact, Digital Equipment, and he's also served as a Wipro's chief executive. And he's also an advisor to both corporations and governments. He has been recognized for his significant contributions, receiving several prestigious global and national awards. Yeah, welcome to the session, sir. Yeah, as you all know, we have today, the session is on the handling medical emergencies. I hope all of you will benefit from this session. Yeah, over to ma'am and sir. Yeah, thank you.
Thank you, Sushma. Thank you for that introduction, and good morning, everyone. And I really thank you for joining us on this Saturday morning. Sure, at the end of it, it will be value for your time, and we promise that to you. We believe, Sushma, that we have, besides alumni, I guess some PGP students and faculty as well here. So welcome to all of you. What we're going to cover here is actually very important for you personally, and not only for you, but your family, your friends, your neighbors. And I think irrespective of age, normally we always feel that it's somebody else who is at an older age that will get into these situations, but it's happening all across to younger people as well. By the way, all of us, including everyone who's on this call, is either a patient or a caregiver. And if you're not a patient, hopefully you remain that way. And I think that's what we're trying to do, that you never be, but you will always be a caregiver to someone or the other. We are all smart people. We are aware. We get the right education. But when it gets to our own health matters, we all suffer avoidable harm. Nadira and I are classmates from IIM Ahmedabad, and both of us have had in our family and ourselves avoidable harm. And when we were discussing all this with hospitals who are working very hard to improve quality and safety, we realized that we as patients don't play the role that we can to avoid that harm. And I think that's what we are going to be covering. I just wanted to mention 1 minute, a little more before I hand it over to Nadira, is, we are taught in the institute, we are taught in our corporations to do risk management. We do all kinds of risk management against environment, political, and whatever else. And we also do it for our own investments. But what about our own health? I think what we're talking about is really risk management of our own health. I'm quite sure when you get to this, even if each of you can take away 1 point, I think that objective will be achieved. Nadira is going to take you on what we do and why is it important for you, and then we'll come back and have a discussion. I hope we have some time at the end to take your questions. Just relax, listen to us, and keep your questions ready. Over to you, Nadira.
Thank you, Som. Thank you, Sushma, for introducing us. Thank you for inviting us. And thank you, all of you, on a Saturday. I know it's the 4th Saturday. Many of you may be having off, but we look forward to our discussions. Som has already introduced the subject of risk management. I like that phrase, right? And it hits hard. But Varsha, next slide. So we started this story, I would say story, just 2 years ago. And Som was invited, he invited me, and we became partners in this whole journey and this whole new project, which is actually promoted by an apex organization called CAHO, Consortium of Accredited Healthcare Organizations. What does that mean? Now, just as all of you in industry have ISO standards and whatever, BIS standards, etc. The health industry works on accreditation, which is a set of standards. So it peters down from WHO, it goes into the countries, and the countries again devise it. Like we have an India-specific board, which is called NABH, and they set the standards. But I think the devil is in the implementation. And these standards, to be implemented well, CAHO, who is our sponsoring body, they train in quality and safety. Two keywords, quality and safety. And this slide, I'll just explain why I'm putting this up right in front. And CAHO works with the healthcare professionals, but and they invited Som and me to work with the patient community. Now, the story behind this is that WHO about 3 years ago did a research and came out with some alarming statistics that harm happening in the healthcare industry with the best of intentions, and the degree of harm is actually the alarming point. So this first line that hit us when we got into this whole game was that 10% of people in hospitals, 10% is a huge number, suffer harm in one way or the other. And the figure is ridiculously high, which is almost 40% when you go to OPDs. And that includes your neighboring doctor, the clinic, the evening people who sit, polyclinics, etc. So we were confused. I mean, we are all Indians. We all have a certain culture and ethos to, bow down and revere anybody who helps us, particularly doctors, or particularly they're like gods and priests for us. So why does it happen? And we got introduced to two more phrases which we want to introduce to you today. One is medical harm. Second is patient safety. I had not come across these phrases together, right? So medical harm, rather avoidable medical harm, is that harm which could be averted. I'll give you an example, all right? It's not that suppose I have stage 4 cancer and I'm going to survive. No, that is not, it cannot be avoided. That's a trajectory of the disease. Yes, act of God, and it's going to go up. But could it have been averted? Could it have been earlier detected? Or could it have been, mitigated? That's the point I'm trying to make. Sri Devi, a classic example of Sri Devi, everybody knows her, beautiful lady, lovely actress. Her mother had a brain tumor detected, fine, act of God. And because of her resources, she took her to America, gave her the best of doctors, surgeons, and she was operated on in Cornell, all right? And the doctor, instead, she had a tumor in the left side of the brain, but he took by mistake the x-rays of another patient, and he operated on the right side of her brain. He accidentally removed her tissues regarding vision, memory, and resultantly, she was not cured, obviously. She had to go for another surgery, and she ended up dying within 6 months. This is avoidable harm. This is surgical practice which went wrong. Of course, he lost his license, and they reviewed everything. But the point is, who could have saved it? We'll discuss that later. But these kind of things happen. Harm happens because we delay diagnosis, medication problems. The second line, I'll show you another slide after this, is the alarming one where today, all of you may be in this range. We don't know you're in this range. You may know you're in this range, but we don't know. Heart attacks, Som is going to take you through that. Blood pressure is going to take you through that. Stroke is going to take it. These are emergency situations. But why do they happen? We'll explain next. So as we entered this domain of healthcare, from our corporate backgrounds, from our academic, next slide, backgrounds, we began to see the inside story of doctors. This is just a slide. I'll come back to this again, but I wanted to bring this up because this is relevant to you. When Som mentioned the risk factor, this is the risk factor slide. This is a summary of 15 lakh preventive health checkups assembled together, and they populated the most common invisible diseases, non-contagious diseases, which are called non-communicable diseases, which we hear every day. Diabetes, hypertension or blood sugar, blood pressure, cholesterol, being fat, having big bellies. I mean, these seem to be so normal to us. But this is where the problem lies. And unfortunately, in the corporate millennium, in the people who work in sedentary lifestyles, the incidence of these diseases is higher than the normal. The red arrow, the red portion that you see, is the difference between the average Indian and the corporate goer. So, for example, blood pressure is 28% in the corporate employees as compared to a 9% average. Cholesterol is even worse. Obesity is there. Obviously, we don't have time to walk, and diabetes is a silent killer. And people die. People actually die prematurely. The two sad parts are it is hitting younger people and the incidence is growing. So both these dangers are there. And I want you to honestly think, take a minute and think, are you in this bracket? Are you at risk? If you are, I think the rest of the presentation will make more sense in mitigating that risk. Next slide. So we went on to study, and first we were invited to conferences. It was lovely. It was a new place. It was a new domain. It's always exciting, you know. I mean, the entrepreneurial bug eats you up ultimately with so many years of experience. And we said, okay, we're going to tell the doctors this went wrong and that went wrong. As Som mentioned, I've had cases in my family which really went wrong. He's seen it. We've all seen it in our friends, but that's anecdotal. It doesn't make a whole story. And you don't base a whole domain on that. So we started listening to the doctors, the nurses, the quality experts, and oh my God, we literally came back with the tail between our legs. I mean, we turned around. We said, Som, this is something wrong. Something's happening here. They were so dedicated. They are so earnest. There's so much technology, AI and analytics and gene technology and predictive technologies. But still harm is happening. Medication, wrong medication, surgical mistakes, all that's happening. But one piece was missing, and that was us. That was us in both the things. They were not working with us. They were working for us. And we were not working with us either. So if you see the ratio of the green and the pink, there are 2 pink boxes and 1 green box. That is literally the ratio of mistakes. That is literally the cause. The perpetrators are none other than us. So as receivers of care, we make mistakes. We don't complain. We are very forbearing. Our threshold of pain is high. It's not good. That much forbearance is not good. We self-treat. We treat other people. You got a cold, take an antibiotic. You got this, take that. You got digestion problems, have dahi. Now, when we do not tell the doctor our whole history, when we miss the signs earlier, when we don't remember our allergies, when we don't keep our papers in order, the ultimate result is the treating doctor either does not get it in time, on chance, or he doesn't get complete information, and sometimes even wrong information. That is what creates harm. And that is what we are going to talk about in parts: normal harm, abnormal harm, emergency harm. And with the philosophy, we realized we did one thing different. We said, let's create awareness amongst ourselves, caregivers, families, people, you, me, leaders, that we should be participating in our care, not just receiving care. And we created an adage, my health, my responsibility, with the firm belief that if I'm aware, as a business person, the more awareness you have, the more clued in you are, the better your output. And that's exactly what we're saying. Aware patients, aware caregivers can prevent health and improve outcomes. So let's see whether we really can improve outcomes. Let's see how we have emergency situations. And I'll hand it back to Som for the emergency part, which we're going to address in the beginning. Over to you, Som.
Thank you, Nadira. What we thought is we have maybe 60, 70 topics that we have already worked on, which are potential areas. But we thought for today's session, we will actually pick up medical emergencies. Now, what is an emergency? And I think you can see this slide. On the left-hand side is common illnesses, which we know what to do with a frequent, rapid, sudden onset, and normally short periods. And, we know how to manage this. And there are chronic illnesses that Nadira spoke about. This has to be careful because these chronic illnesses always lead to even more serious issues. And we will dwell on it later. And I think, we have a lot of material which you can look at. But what is medical emergency? So it is common, chronic, and it is sudden, unannounced. It's first time. It may only be the one time that you will get it. Maybe it's the only one time that somebody in the family get it. So you're unprepared. It is life-threatening, needs immediate response, and we don't know what that response is because we don't know about it. Affects long-term health. It leaves you deliberated in a lot of ways. And there is no time to search at that point. You can't Google if you're going through a medical emergency. What shall I do? And what are these? Heart attack, stroke, seizure, head injury, choking. right? And these are two situations. One, when you're alone yourself and you're having this. Other, you have somebody around you. And I think it's important to know what I should do and how I should take help. So we're going to cover a few of these, particularly the ones that are major ones. Of course, every one of them is as serious as the other, but we're going to take you through this. And I think we're going to share. A lot of people, we avoid sharing our own personal experiences, but unless we make it personal, it doesn't work. Next slide, please. So the emergencies cannot be treated at home. There is no time to lose. We cannot miss what's called the golden hour. It deteriorates very rapidly, and hence the reaction time has to be fast. Every minute that we lose makes the situation worse. And you've seen it in movies, you've seen it happening to. Once it happens closer to us, then we realize how serious it could be. So I think it's about handling as first thing is act now, right? And for this, how would you know? Are you aware of the symptoms? You might have what might be a splitting headache, and you probably say, I need to rest out, or maybe there are other. Sometimes the symptoms are first time, you don't even know what they are. And hence, in all these cases, do you know who to call? Do you know which medical facility to go? Are you going to drive or wait for the ambulance to come? Are you going to take a medicine and try out something yourself? Do you know how to give first aid? I think these are the important questions. We are not doctors, right? But we don't have to be doctors to do what is we will call commonsensical. And I think we're trying to bring all that material in, approved by doctors in a simple manner that we can all relate to. So let me start with the first one, which is a stroke. Can we go to the next slide, please? Yeah. So what is a stroke? Actually, stroke is nothing else but blood stoppage to places in the brain, which is all the time getting nourished by blood and oxygen. And there are two kinds of stroke that could happen. Either it could get choked, that means there is a clot which stops the blood flow, or there is a hemorrhage, which means the blood is oozing out and not going where it should be. And what does happen with this? That when the blood stops going, then one by one, rapidly, those brain cells start dying. I can tell you they die very fast. So that's why we say golden hour, right? The body is good. Body was designed by God to react to it. But many of these, right, are even beyond that repair work that otherwise the body tends to do. Now, let's go to the next, please. So what happens when you get a stroke, right? And this is very important for you to know. There could be loss of balance. You could have blurred vision. You can see the face drooping on one side. Your arms suddenly feel weak. You can't lift it up. Your speech is slurred, right? These are all signs of a stroke happening. How many times do we face this? Does any one of this is a normal? This is not fever. This is not headache. This is not pain. These are all new. And when you get a new symptom, you are wondering what's going on. My wife, early in the morning, had one of these. She thought she was not normal, and we live in a house. We lock the doors. She goes and opens the doors. I was away to Bangalore. She opened the door and came back to her home. And she thought things are not right. She called our security person outside, who was our caretaker, and asked for my daughter and her mother to come, who lived nearby. And thank God they came immediately. And then they started doing, and then they found this was it. And clearly it was that she had symptoms of stroke. Good news is that she didn't decide to, have a crocine and lie down and saying it'll get better. And immediately the physician was called, and they showed a video of her state. She was speaking. Everything was otherwise looking okay, but she couldn't come. She was not coherent in a little way. And the doctor immediately said, rush her to a hospital. And he also asked us to call the emergency, which we did, right? And she could make it in a short while. Now, these are, the reason I'm sharing this is because these symptoms don't come often. And you can see the incidence of strokes happening across. By the way, while the more senior people are more vulnerable to it. It can happen anywhere. It can happen to my parents. It could happen to my brother, elder brother, neighbor, but also happening to younger people. Can we go to the next slide, please? So what do you do when you have it? Immediately share with someone in the family, neighbor, because your situation will deteriorate very fast. You will not be in a situation to even call a doctor. Now, once you have somebody there, lie down, stay calm, keep talking to the patient as long as the patient is coherent enough, gather more information, because the doctor is going to ask you what happened, what time did it happen, what were the symptoms. Because normally what happens when I'm a patient, I go to the doctor, I tell him my symptoms. But if you had a stroke, you can't even communicate. If you have a family physician, take their advice, because it shouldn't be that you thought you were having a stroke and you're just rushing. You might want to reconfirm, and your family physician shares symptoms. They will be able to tell you. Do a video call if you can. All of us do video calls all the time. Do not take any medication. And just in case of a stroke, for example, if you took you took an aspirin when you actually had an hemorrhage, you will bleed more, right? And vice versa. So I think it's best to avoid anything. You can't wait for an ambulance. Now, if you would go in the West, they will say call 911 and it appears in a few minutes. It's probably a stroke van that will come. But in India, they won't be able to reach you either because of the traffic situations, and Bangalore better than anyone else. So the best thing is to drive to the recommended hospital. Now, what is a recommended hospital? Normally, all of us have our favorite doctor in one hospital. So let's assume you were in Banarkata at the IIM campus, and your doctor that you visit is in Manipal, right? It's going to take you long to get there. You'll get stuck. So it's not important for you to go to your known doctor. You have to go to a medical facility which has an MRI and CT scan. Now, do you know that which is the other hospital near you, which is with MRI? And would you ever do it saying, why do I need to know a hospital which is near me? I think you know so many other things that was not necessary for you to know, but we are all the time reading and getting bombarded on WhatsApp. So why wouldn't we know this? Now, if you did go to a hospital which did not have MRI and CT scan, they will not be able to diagnose. They will probably rush you to another hospital. There goes the time. So it is important for us, even when we are healthy, to know which hospital is nearby. We don't need to know the doctors, but we know that this is a super specialty and they can deal with an emergency like this. Next, please. So coming back to, can you go back? So this is the response. Now, I didn't finish with what happened in my wife's case. She was rushed into emergency. Can you go back to the slide on stroke? And the emergency people were waiting for her because we had called them from the car, and the CT machine was kept empty. She was rushed straight to the CT machine. The CT scan was done. It was detected, and immediately they did the procedure and removed the clot. The net result was that she recovered. She lost her speech completely. It was erased. Her vocabulary was erased, but she did not have physical disability. It's been now 5 years since she had that. She has recovered almost 90%, but it took her that period. But we were fortunate because of all the steps that people around her took, and she reacted the way she did, that today she is kind of normal, plays bridge, and so on. That is the point, that it may be an emergency, it could be a stroke, it could be a heart attack. You can get back to normal life if you acted fast. Okay, let's move to heart attack. Everybody hears about it. And, we ourselves are saying, hey, what is heart attacks? What is cardiac arrest? What is heart failure? These are all loose terms that we use. I'm only going to cover heart attack here today, but they are different. The responses are different. So heart attack, as you know, is very, very common. And that's why the discussion on cholesterol and so on goes. It's basically what happened to the brain in case of a stroke is happening to the heart, where your arteries are getting choked because of a blockage. It could be a blockage due to cholesterol, it could be whatever else happens, it could be a plaque breaking from somewhere and stopping it. And people who are at risk, we very know. And, a lot of times we say he's type A because we are stressed out and all the time working hyper in our work. And, we always think it's the other person that will get it. So this is, this again, no blood to the heart, the muscles start dying, and very, very soon it stops pumping. And you know what the consequences, if you don't pump blood, what happens? Next, please. So, we've heard about all this, pain, discomfort in chest, neck, jaw. There is, suddenly you don't feel well. There is anxiety of a very different nature that comes in. Shortness of breath, rapid heartbeat, like you said, heavy sweat or cold sweat, and, feeling dizzy. By the way, even before this happens, the body is quite well trained to warn you. Because if you are stressing yourself and walking, and if you feel what's called the angina pain, angina is actually talking about some pain unusual, which is heart related. And that may be the time to do. But when you're having a heart attack, these symptoms will happen. They could be one, two, many, or there are many other symptoms that could be there. And majority of the time, you would like to believe that it's not heart, it's gastric. I've got a gas problem and that's leading to all this. And there is very often a mistake happens. And the question there is that it could be gastric and not a heart. Are you going to take a chance? What will your risk management tell you, right? If you know that you have known gastric, maybe you're right, but then the situation would be very different. Few years back, Nadira was also there. We had gone on a holiday to Sundarbans. Before I went there, I was doing a walk in my sector, and I had little different kind of a chest pain. I went to my cardiologist the same day. I have normal gastric issues, and he did say to me, your heart is fine because we just got your checkup done. Everything was great. So, I think this must be gastric. The day before I left for Sundarbans, I still went to him and he said, look, I can't see anything here, but since you feel this way, just carry these medicines with you but you won't need it, go enjoy. And I did go. We went to Sundarbans, we had a nice time, but that late night, I had severe, unbearable pain in my stomach, which was unusual. And I took everything, including the medicines that by chance we had bought that my doctor gave. And I didn't know what to do. I couldn't sleep. In the morning, I got up, I woke up Nadira and Amit and told them, hey, I want to go back. I traveled 16 hours to Delhi. I didn't know it was a heart attack, but when I went to the hospital, lo and behold, I had an attack. But I asked the doctor what saved me if I had a heart attack. And he did mention that, look, you took all those, the event passed. Also, he mentioned that because you are, you walk and so on, your capillaries got opened. The point is not about me. The point is it can happen all the time. And my guy was saying, the other doctor told me, hey, why don't you go tomorrow morning? You seem okay, we'll take your gastric. But we went the same night. I could have delayed it just saying it's gastric. But here is a case of mine. I am fortunate that, the doctors worked well. I am almost 100% recovered from there, except that I'm more careful than before. So please do not ignore, right? It could happen anytime to anyone all the time. Next, please. So here again, if you're having it, inform someone nearby. I did inform Nadira and Amit. Open the door, how will you get help? Relax, chew an aspirin if you're not allergic to aspirin because it opens up your blood vessels. Speak to your physician. There can be a cardiac ambulance if it's nearby. The cardiac ambulance treats you while you're on the way to the hospital. But if you don't have the hospital near you, don't delay, ask someone to drive. You cannot drive yourself. Please do not drive because you don't know what the situation will be. And if someone else is happening, I think you have to do the same. But if the person is not responsive, perform CPR. We have all heard it. We have seen it in movies, how the CPR works, what is to be done. But, just glance through the what CPR does and what you have to do, because you could save lives. And again, please drive the patient to the hospital, don't wait. So that should be your response. So you've seen what could be the symptoms, what are the consequences, and what response do you need. So it is different from cardiac arrest, as I mentioned, and there are many other types. That's blockage in case of heart attack. In cardiac arrest, it's a electrical malfunction. That means the signal that the heart gets to pump doesn't happen. The arrest happens very, very fast. Person becomes unresponsive, unconscious, gasping. And I think that if not attended, it could be worse in a lot of ways, because so you could see that in India, unfortunately, we do not have the AEDs all over. In overseas, it's compulsory to have an AED at every public place. I think it's getting here as well. But please start CPR right away, because you could actually save a life. So I think differentiate, knowing the subtle differences between heart attack and cardiac arrest could help you save lives, or your own, or your families, or your loved ones. So it's good to know there are lots of work we have done on what is a heart failure, etc. And I think you can do this. And of course, preventive health checkups do tell you your situation and your vulnerability, so you know you're better prepared. Next, please. So this is, I don't have to go to details. This is the CPR. We are putting it here because it's important to know this for any one of us. And again, I'll say, we might say, why do I need it? And you can't do it on yourself. You always have to do it for someone else. But it's important that you do. There are videos and so on available, but this picture itself tells you, what to do it. Next, please. So the third one we picked up was choking, right? And choking, when something gets stuck in the windpipe, it could happen to adults with food and fluids. It could happen to, suddenly you choke a large seed, right? And it gets stuck there. Sometimes it happens with just a big lozenge that you were chewing on and it gets stuck there. Young children often do it on small objects that they pick up. And again, here, it is stoppage of supply of oxygen that happens to the brain, and the choking prevents, and you're very uncomfortable. You don't know what to do. There are all these symptoms that you can have, children, their ability to make sound. It's not only children, but also any one of us, those become, but we have to recognize, sometimes it's happened to people sitting in meetings that they were chewing on something, it happens, and they're just stuck. It just gets stuck there. What do you do? I don't think you need to be embarrassed about it. You just have to tell someone nearby that you're going through this. So what would you do if you see choking happening? Or what would you do if you thought you were choking? Next, please. So here, if you are an adult and you see it happening to you, and you can ask for help. And so if you see somebody getting choked, is choking, then stand behind the person. And, these are very proven techniques where you're putting your arm around, making a fist there, grasping the person, and giving abdominal thrust. 90% of the time, it will get dislodged, what was stuck, and come out. And I think it will give immediate relief, and I guess it's back to normal. But just this little blockage that happened could be very devastating. And the after effects may not be as bad because the effect was changed. But what do you do if you were having, and you were choking, and you were alone by yourself? Next, please. And this is what you would do, right? You don't have a person, but you're simulating as if somebody's doing it behind a chair. You don't need any equipment, anything. Just putting your, you see the fist and the arm, you just put it on your navel and bend over a countertop, chair, whatever, and try and shove the fist inwards and try to cough it out. This would help you get over the choking. Honestly, when we were preparing, I've seen people choke. Unfortunately, it got dislodged, but I wouldn't have known if I was having it what to do. But now I know. I hope you also now know, and God forbid you ever had to choke, or you know what to do now. So let's go to the next. So The same thing happens with children, small children. Now they can't be given the same kind of treatment. So I suppose the nurses teach you, etc. But there would be times that you as a parent might be facing it. There may be no nurse around you. Your spouse is not there, or to help you. You have to do it yourself. And I think these back blows and chest thrusts very simply can actually also move away from that life-threatening choking that happens. And children do choke because not only on food and milk, but they also choke because they're curious and pick up anything on the ground, and the first thing they try and do is to put it in their mouth. Adults, somebody else, you yourself, or children, I think choking could be a big emergency which you can prevent. Okay, next, please. So we covered only 3, right? But a seizure is an emergency. A heat stroke not addressed could become electric shock, severe burns, fall at home, fall in hospital, cuts, bleeding, a dog or a snake bite, particularly a snake bite. Do we know what to do? We have to act immediately, and awareness can help us prevent serious harm. And I think it's important that you just keep this behind your mind. You don't have to read more. You just have to keep that little awareness. Most of it we'll provide to you in very simple language. I hope this wasn't technical. It was clear to you that this could happen. So if I have to summarize, in case of emergencies, and go to the next one, please. Risha, can you move the slide? Yeah. Emergencies come unannounced. The right response and speed is critical. You would not be able to read about it. I think, while we'll tell you more about diabetes and cholesterol and so on, you can still read about it. Not when you're going through an emergency or you're losing time. Be aware that it is an emergency. Inform someone, seek help. Don't worry, it does not matter. It's a life. The whole world will come to help you. You need to just ask for help. There is no embarrassment in a meeting or whatever. You've seen how many young people collapsed, or we just had a professor who collapsed giving a talk and a lecture on the podium, right? It can happen anytime. So do inform someone. By the way, the reason for telling you all this is emergencies can be devastating, but you can prevent it. And I gave you 2 examples. One, who's speaking to you, and my wife. We came out of that emergency, thank God, and thank the doctors, and thank all the people who were around us who acted fast and helped us in saving our lives. And we are fine, right? So were we lucky? Were people around us well-informed? Whatever. A combination of this. Having gone through this, I thought we should share this with you. Please do go to a well-equipped hospital. I hope after hearing this, you're just going to check out which is the best hospital near me. And by the way, you are in Bangalore, but your parents are in Chennai. You know which is the hospital closest to them because they may need help. Please keep emergency numbers handy. We all know 101, 102, XYZ, but we don't know about the ambulance number. We sometimes don't know. We have every other number around us, movie theaters, restaurants. We know how to go order food, but health is the one. So with that, Nadira, I hope, we would have people more alert to emergencies. We have a lot more stuff, which hopefully we will find ways and means of reaching you through the alumni office. But Nadira has more to share.
Thank you, Som. And thank you, everybody, for still being here and not logging off. There's much more to come, so please don't go away. And I think some of our links have been posted on the chat box for the other material. As Som mentioned, we've got a arm-long list and it's growing every day. So please do visit, please capture that. But let's come to the next slide. Now, Som mentioned the key takeaways for emergencies, but who causes them? Why do they happen? Next slide, Varsha. Who is what's behind it all? Sadly, as I mentioned, when we investigated, when we took an honest look at the industry and the doctors doing their best, it was we ourselves who actually cause emergencies. You are all scientific people. I'm sure there are lots of IITs here besides the IMS, so there's an engineering brain behind this. You worked, many of you, many years, you're leading industries, you're leading departments, you're leading ventures. So a root cause analysis comes naturally. It's just there in your blood, right? A fishbone analysis in your blood. And when you go just one layer deep of why somebody got a stroke, why did his heart suddenly stop? Why did that thing happen? It is because something dislodges and blocks there. I remember this case of, he mentioned choking. Okay, fine. I just reminded me, several years ago, we were very young, and Air Marshal Subroto Mukherjee choked. He was in a Tokyo restaurant eating wonderful Japanese food. He choked, the food got stuck in his windpipe, and within minutes he died because his air passages were blocked. These are real cases, right? Raman Munjal, my husband started Hero Honda, this is in 84, and within 2-3 years, they launched the bike, excellent progress. We were waiting for a celebratory dinner, everybody waiting in the hotel. Munjals were very, very good with employees. Ramanji never turned up. And the rumor spread that he had died on the treadmill. He had gone for fitness, he was cycling, and he just got a heart attack. It was shocking. How can somebody so gentle, so kind, so intelligent, so inclusive just die? But that's what happened. These are real cases. And the causes, because diabetes is sugar, the excess blood glucose goes and deposits itself in the blood arteries. Blood pressure shoots up the pressure, bursts the artery. Cholesterol is like plaque in your teeth. It's the same story. It lines in the artery. And when you have something really heavy, whether it's a marathon, whether it's excess work, it dislodges and goes and blocks it or ruptures it. So these are the real devils behind it. And we are nurturing them. We are literally allowing them to grow in our bodies. Sometimes I think we cause the emergencies, and it's not that a doctor causes it. Next. So we try to understand who can prevent it. You've already seen this. I just wanted to highlight it once again, the degree of emergencies caused by corporate employees, right? It was just a reminder slide, and we talked about it in the beginning. But I think when he mentioned his examples, and I'm mentioning the reason, this comes together, and this is the danger level, hidden dangers, potential dangers that we're all suffering about. So let's see, is this only for the doctors? Should it be only for the nurses? Next slide. Or should it be only for the lab technicians? No. The whole point of Patient Safety Foundation, the whole point of our work, as I said earlier, is that let us do something about it. Let us be partners in our own care. It is for families, caregivers, people like you, healthy people, energetic people, your wife, your child, your mother, your aunt, your office colleague, your neighbor, your traveler, any of us and every one of us. Anyone can be using it. But how do we do it? We always say you should do it. And you say, oh, I have Dr. Google. No, wait, I'll come to Dr. Google a little later. But right now, the 3 simple formula that we want to suggest is, and we've mentioned it earlier, be aware of symptoms, that it is not a heartburn. It could be something more. Just 5 days ago, somebody came to my house to give some donation of stationery. And she had lost her husband. In his memory, she was giving. I said, what happened? She said, we came back and from Goa, from a lovely trip. And we'd eaten too much, probably spicy food, tasty food in Goa, heartburn. But in 3 days, he was no more. So I asked her, did he have pain in his jaw, arm, neck, back? She said, yes. I said, was he dizzy? She said, yes. How do you know? I said, frankly, 2 years ago, I didn't know. But now, this is the work we do. And now I know the combination of symptoms, which could mean a heart attack. And if you know it, you can act upon it. That is what awareness is about. Second is being alert and being responsive. It's not somebody else's job. It is your job. It is my job. Be alert. Be careful. Don't just put up your feet when you go to the hospital and take out the social media handles. No. And being aware is not enough. Having prior preparation, being practical is as important. So this is what we are trying to do. But how do you do it? And here you will tell me, a very common question people ask us is, but we know Google, so what's the big deal? Next slide, Varsha. What's the big deal? What are you doing that is different? What are you doing that is special? We all have wellness. Many of you have health and benefits, I think that's the latest catchword I heard in the industry. Benefits program, wellness programs for employees, insurance programs, medical, you have tie-ups with mental health people. Agreed. You have Google. Absolutely. We also go to Google. But during an emergency, do you have time to go to Google? My brother-in-law, this was 2014, 9 years ago, 10 years almost now. He died of a heart attack. Simple, 51 years old. And he always woke up his daughter for school. That morning, he didn't wake her up. So she got up and she went to him and, Papa, why didn't you wake me up? My alarm didn't go. I'm late for school. She touches him. He's stone cold. Shocking, young, energetic, not fat, nothing. So they go to his desktop. The desktop was open. The page was heartburn and heart attack, digestion problems, was open on his laptop. He was feeling uneasy. He asked his wife, my bhabhi. She said, take a dispirine, take a gastric tablet, go back to sleep. He tried that, but he was still uncomfortable. He Googled, but nobody believed him. Nobody understood the magnitude, and he passed away. Perhaps if the wife, perhaps if the caregivers, perhaps if the family was clued in, and that is why we ask you to share our work with everybody, maybe a life would have been saved. So here we are, summarizing, simplifying, collating sensible data on 3 counts. Number 1, what is the definition of a heart attack? What is the definition of a diabetes? What is the definition of dengue? What is the definition of anemia? We have a whole wide range, okay? What are the symptoms? What are the combination of symptoms? One symptom alone doesn't matter. Why? Because you can detect it early. And we're just alarming you about the harm. We're not saying you have it, but there could be a risk involved. And if you ignore it, we want to make you understand. We want the world to know that there are consequences of ignoring. There are consequences of not taking action in time. And therefore, we have come out with the last section of actionable self-protective tips. Because there's no point just having information, as we all know, unless you can act upon it. I think our entire story of our corporate life, of our academic life, has summarized into these 3 words. You have to act on your knowledge, not just knowledge for knowledge's sake. And most importantly, who's going to do that? All of us. We have a role. We talk about rights, we could talk about responsibilities, but we have a role as family people, as human beings, one to the other. And our work, we aggregate from the best of the sources, but thanks to CAHO, thanks to the industry for giving us that platform, we have access to the best of the doctors in the industry, and we do not ever publish anything unless it is vetted out by at least 2 doctors. So you can trust us. It is simple, quick, easy, and we have translations in 12 languages. So we are different from the normal, an apple a day or 5 almonds a day. We are slightly different there because we are focusing in a niche area of risks, safety, harm, most importantly, your contribution to your saving. That is why we are important. And I'll give you some examples of how we do it. Next slide. So I'm going to run you through a few examples of our work, along with an example of real life. All these came up with anecdotes, all these came up based on experiences of people who really went through it. So I think that is our value add. It is not just theoretical. No, for each of these boxes, we could rattle out, I don't think we have so much time, but we could rattle out examples. Patients can help improve outcomes. Patient can help improve diagnosis. I told you about that. Another friend came, and for 2 years, they had she had some digestive problems. Her husband had it. Indigestion, diarrhea, constipation. Okay, take curds. Okay, take soft foods, take more water, hydration. You start doing it all until finally the system became so acute. They were self-medicating throughout. That's dangerous. They did not inform the doctor of the symptoms early. Dangerous. They took everything in their own hands until it was detected as 4th stage colon cancer, and he had to go for a major surgery. So if we do not tell all to the doctor, if we do not tell in time, we can make a mistake. But if we do, the doctor's hands are better. There is a small little box on the left corner here. I just want to spend a minute on this, and an honest question I'm going to ask all of you. It says maintain medical records in order. The above is fine. Family history, communication with doctor, etc. is fine. But What is the meaning of this maintain medical records in order? Whose job is it? Is it the hospital's computer? All of you are working on laptops, smartphones, blah, 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 all of you. Nobody can live without it now. If I honestly ask you, don't have to give me the answer. I say, how many employees you have? What are the client lists you have? What are the product lists you have? What's your bottom line? What's your top line? What is the worst expenditure? It won't take you more than 3 clicks to get that answer. I'll change that question. Do you have a record of all the episodes, medical episodes, hospitalization episodes, non-hospitalization, about yourself? Do you know the medicines your wife takes? Many of you live abroad. Do you know the medicines your parents take? Think about it. Is it in one place? Maybe 1%, maybe 0.5% of you may have it. But even we don't have it. The moment you get your insurance, you forget about the file, you dump it onto the next episode. Just that act of keeping your order, keeping chronological order, might help your next episode. And that's where we can contribute. Prevent diagnosis errors, prevent treatment errors, and help the doctor to help you. I mean, I could go on, but let's just go to the next one. So this led us to the next topic. This again came from a real life situation. I was interacting with a bunch of patients, and in another sphere, I mean, they were all cancer patients, all right, lower strata. And I said, I was taking a session with them, and I said, how are you? Everybody excited. They took out their bags and they started taking out their histories. 1 minute, 2 minutes, 3 minutes, 4 minutes. Somebody couldn't find the report. Somebody had a tea stain, a samosa stain, which is okay. They live on the streets. But nobody, except one little girl who had everything on her smartphone, could give me the latest test report, prescription, and medical history. So we came and asked our friends. And amazing, none of our friends, colleagues, families, associates, they had the same answer. We don't know where it is. And when you go to a doctor, you blame the doctor because doctor didn't have time. Did you make time for the doctor before you went? If you want to really make the best of it, doctors give you 7 minutes. You have a 15-minute window, 3 minutes for the nurse to do your pre-medical, 2 minutes to pay the bill, 7 minutes for the doctor, and 2 minutes for him to write down. If you want to optimize that, productivity, we talk about that, right? Write down. It's simple, elementary, my dear Watson. That's why it's so simple. Write down your questions before you go, maybe even in the car. Make notes when he speaks, because you're not going to remember the real words. Take your reports, take your prescriptions, write down your histories. You plan for time, go for 10 minutes. We don't do it. We rush from one meeting to the other, from one job to the other. But I think health requires time and the doctors need time. Sometimes we are scared. Why should I ask the questions? The doctor will get upset. No, you're saving his time. We've seen this happen. You're saving his time, and so he'll appreciate you. So spend this little placard of ours is being used in hospital OPDs. It is being used in clinics. It is being used by patients. It's come out very simple, but very effective. This is just an illustration. These are simple versions. We have more complex versions. Next slide. So we do this for normal work. Okay, all of you. This was another one that came up, again from personal experience. Som had a friend, their bags got lost. I went to Sydney. My bags were delayed. Fortunately, I was not on any heavy medicine. But it took 3 days, and by then we'd already moved from there to Melbourne. But suppose you are traveling, and this happens often. All of you are jet setters, I'm sure. Did you take medicines? Yes. I always keep them in a pouch ready. By the time my next travel comes, I don't travel that often. Some of them are expired. I need to check. I need to throw out the old medicines. Did you take enough for a week in your hand luggage? Don't wait, put everything in your check-in luggage. Everybody knows. Only thing you need to do is carry your prescription along with it, so that in case the customs stop you, you have a prescription ready. It has 2 advantages. If you run short, if your trip is extended, which can happen, your flights can be delayed, can be rain, they can be, terror tracks, whatever. You have a prescription, a legitimate paper, which you can show at the pharmacy. That's not India. Indian, I just call up my chemist. I need a medicine for vomiting. I need a medicine for a cold, and he sends it to me. It doesn't happen like that overseas. You have to show the salt. You have to show a licensed doctor. So carry your prescriptions, carry enough supply, and carry the correct versions of what you have to do. Be careful when you travel because your health can go wrong even with the time zones. So these are just simpler ones. But I think another very funny one, next one is coming up, is really amusing. It came up next. It came up on demand from one of the presentations we were doing. In fact, my granddaughter continuously has a lower backache. And we said, oh, she's in the 10th, poor thing, she's studying so hard. But, that's why she's happening it. And then I saw this picture. We have a dedicated team of researchers and content writers, and they picked up this picture and we were really amused. But then, the answer lies in the next picture. And they said, no, ma'am, this is only half the story. And the next part of the story, Varsha, move the next one. They said, the backaches come because of this. So it was as simple, as elementary. These are parallel lines, perpendicular lines. We need to keep our back straight. We need to keep our legs horizontal. The upper legs horizontal to the ground, the feet firmly slow, eye levels. We hear about it. We don't do it. We take our phones while walking, sitting, jumping, walking, everything. Next slide. We go wrong. Our posture is the key to preventing backaches, to not having joint pains, to not having muscle pains. But it's so simple. We teach on these, we give you these, we can give you these pictures. You put them in your medical rooms, canteens, floors, slide TV screens, digital screens, use everything. We're giving everything free. Of course, there are more complicated versions as well. Next one. We talked about harm. We talked about, how we can prevent harm. We are still working a lot on symptoms, and we're also working on protection. I'll start with the last slide, adult vaccination. Tell me the last time you had any vaccination. And if you did, I'd be really happy. But the normal story is, I'm old enough, I don't need it. Vaccination is for children. No, not really. COVID taught us that vaccination is for everybody. But it's not only COVID. With age, immunity goes down. With age, the effectiveness goes down. With time, new sciences, new things come up. The HPV vaccine, I'll give an example of the HPV vaccine. That's a relatively new thing and is being bombarded very, very prominently by the ADBM, the ABHA, the digital government, the primary schools, the public schools is all promoting it. Why? What does HPV vaccine mean? What does an HPV test mean? I learned it because, again, for my granddaughter. She was below 15 and we went for something else and the doctor said, has she taken it? I wasn't even aware. But if I was not in patient safety, if I had not been understanding the value of vaccination, I would know. So HPV test is a test to check whether you are prone to cervical cancer. So far, there were no tests for cancer. There are individual markers, but there are no tests, unfortunately, right? But an HPV vaccine prevents cervical cancer. That's new. And girls below 15 should be taking 2 doses. Women up to 25 should be taking 3 doses. And more importantly, young boys should also be given. Now, that was a revelation to me. I was surprised. Boys? Why would boys have cervical cancer? No, boys can contact the same cancer. Boys can contact HIV because the modern society is different. The intimacy rules have changed, and young boys are also susceptible. So if you prevent them, protect them now, they can do it. So new things are happening in this age of science. So we can prevent other people from getting it, not just us. So I think that's a great learning, right? You can have a camp about that. The middle one, medication safety. Do you know the alarming amount of errors? 50%. 50%. Wrong dosage, wrong timing. We had a senior person, a mother of a university dean. This is real. We were giving a presentation. I don't want to take the name. She took medication of deworming for 3 years instead of 3 weeks. She had to take 3 weekly doses. She took for 3 years until she collapsed. We all take over medication. Have a cold, take antibiotics. Have something, take antibiotics. Result, AMR, what they call antimicrobial resistance. When you really have a chest infection, that antibiotic doesn't work. So we ruin ourselves by self-medicating, prescribing others medication, and all that. All those horrors keep happening. So we've got lots of material on all these common mistakes we make. but also there's hope. There is protective and preventive measures that we are at next slide. So we are doing things for the elderly. We are doing like this one. You can use it for elderly. You can use it for young people. Anybody can have a fall. My brother-in-law, we lost him to a fall. He was in Chicago. He had gone for a walk. He fell flat, just a loose tile. He snapped his neck. It was Chicago, it was America. He got the best of treatment. Immediately the state stepped in, no expense, all the expenses paid, but he got paralyzed, paraplegic, all 4 limbs gone. They moved him to India because you can't stay in America forever. And he continued to get treatment, but the food was difficult to feed and it went in the windpipe. It caused infection. That's incidentally aspirational pneumonia. He went into sepsis, all his organs failed, and we lost him in 6 months. What was the cause? A fall. So don't treat falls mildly. It's not just about a knee replacement or a hip or an ankle break. And can you prevent it? Yes. Simple things. In the bathroom, install grab bars near the toilet seats, in the shower areas, bathtubs. At this age, at younger age, yeah, we used to love them. At older age, maybe they're slippery. Okay? All this is really, really difficult. Steps. Don't start talking on the phone, coffee mug in one hand, phone on the other hand. You're climbing up, somebody rings the bell, you turn around, you slip. Dangerous, right? Keep a hand free to hold the handrail. Have a handrail always. It's stylish not to have it. It's stylish not even to have a banister, but you must have that. Mark it. Please mark it with red tape, yellow tape, whatever, so that you know. Loose clothing, loose slippers, loose rugs, they're all detrimental. So decluttering is important, keeping it well lit is important, because it's not just the fall, it's the post-fall. You lose mobility, you may lose your friends, and it's a downhill spiral. So this is just one of the things. Next one. Even an elementary thing, we talked about blood pressure. Yes, how do you take your blood pressure? We take it at home, we've got instruments, we're all wealthy, we're all knowledgeable, we write it down, but we take it the wrong way. Do you sit alert? Did you release yourself? Did you go to the bathroom? Did you rest? Maybe your calibration is wrong. Maybe you were moving too much. Maybe you were talking on the phone and doing your laptop while you're taking the blood pressure. All these errors end up in your readings. So what? So yes, what? You take that reading chart to your doctor. He believes you. He bases his treatment on your readings. And so the treatment is wrong. Whom do you blame? The doctor. Who was at fault? You. So we have to be careful at home. We have to be careful in the hospital. We have to be alert when we sit in the hospital. It's a great time to learn. Watch the nurses. Be attentive at discharge times. We don't have the time. We're running from the insurance, the TPA, the paperwork, the reports. Next, we are very busy. Okay, spend a day earlier as a caregiver and learn. And we can all do much better if we are working. No, I want the slide that I think you skipped the scan to leverage. Wala. So yeah, wait. So this is what we are doing. This is what our story is. Our story is growing, and we are here to request for your help. Can you help? Yes, you can help. Just a few suggestions. You are wearing 2 hats. An individual with a family and a leader. You could be a department head, a corporate head. You may have your own businesses. It's not only for you. It's for your family. It's your friends. We will still make mistakes. But if we're aware, if we know where we have this material, we might be better off. So if you really believed, if you really understood what we're talking about, and I hope we'll take a call after this, please give us your feedback. If you believed in what we are doing, why we are doing it, how we are doing it, join us. Spread this, amplify this to your companies. We have collaborations with so many organizations. We've got 20 lakh employees already being addressed every week. We send it, our model is hub and spoke. We send it to a spoke in your organization, and you send it further to your employee base. We are not interested in gathering your data. About the context, no. You want to give a test, fine. If they want to subscribe directly, very welcome, because we have weekly updates and we have much more happening. We are also working with healthcare industries. We are working with hospitals. They are using our material. We are taking initiatives beyond this, and we're going into the domain of providers, that how they can strengthen. We're taking the voice of the patient to them in a structured manner. So it's not only with you, but we're doing back-end work. And it's a mindset change. It's a behavioral change. But unless all of us are together in it, unless all of us believe, as leaders, you have to believe you can drive that change. You have the power. You have the influence. Only then it's going to happen. We've got formats which are suitable for websites, mails, social media, videos, WhatsApp messages. All the formats are available. Posters. Create a library in your website. Send it, share it. There are no commercials. We don't charge anything. As individuals, you can do much more. You can become ambassadors and share it in your golf groups, in your bridge groups, in your gym groups, family. Everybody has 100 WhatsApp groups these days. Subscribe to it freely. Use it. I have one more request here. Employee engagement. In another NGO, we've worked a lot on employee engagement. Create a model, create a program, employee engagement. Let them work with us. We need a chatbot. We need social media promotion. We need to create an app. There is so much demand coming up. We need to create videos. If you have skills, please, that will be your CSR. We are not asking you for money, at least not yet. You want to give it later, most welcome, because we have a team to look after. But we need skills as well. Your employees need work. This is meaningful, long-term impact, sustainable work. Help us to do that. Whether it's an individual hobby, whether it's a collective exercise. So there are so many ways. You can contact me, you can contact Varsha, we'll give you 1,000 more ideas. And they're working. These are real ideas in force right now. I'm not talking through my hat. And the more we discuss, the more we collaborate, the more ideas we can generate together. So please, please join this journey and help us move. And I will just give you just move to the next one. You can take a screenshot of, what's the next slide? Yeah, just take a screenshot of this. Everybody take a screenshot. It's free. You can subscribe, access our newsletters. By the way, our posters are in 12 languages and 4 in the south, 2 in the north, 2 in the east, 2 in the west. Use it, share it. We even have one for the Middle East. Okay. And because why I'm giving you this link is because there's continuous updation. We are modifying, we are adding, we are improving. And fortunately, the healthcare industry is on board. The private sector is on board. You're a member of a Rotary, a Lions Club, and in a wheel, please help us to share it. So your help, our help, together, I think we can improve outcomes. As they say, success is even if you impacted 4 lives, 5 lives, 3 lives, that is success. So we wish you good luck. We wish you good health. And I'm open to questions. So if you have to add anything, please do. Sushma, Utanka, I see that you joined. Please do. It's okay. Please add us.
No, thank you very much, Nadira. I think basically, this has become a mission for us. There are a lot of other people like all of you on the call here who are joining this mission, helping us. There is no end to this because, as I mentioned, patients and everybody is a patient and caregiver. And I think if we can raise this awareness level, I think we can, probably move away from this stupid stigma that we have as a disease capital of the world. Right? I think we can play our role to tackle that. I'm not sure, Sushma, we have time for questions. We had, of course, set aside time, but happy to take any questions. I want to thank everybody who's come here and been there with us through this last 70 minutes, but happy to take any questions. And ask us anything. If we know, we'll answer. Otherwise, we'll research and come back to you.
If you can, you can unmute, I think, others and ask. Otherwise, you can share it in a chat, your questions and feedbacks. I think we have only one. I think you have shared something. I think Mr. Deepankar.
Yep.
It's just a sharing. Identification of general physician who will treat one over a period and know the patient as a journalist and not as a bunch of journalists will be a good way to protect oneself. Yeah.
I think that's a very important question raised. The issue today is that everybody is becoming a super specialist and there are lesser and lesser family physicians that used to be there, but they are still there, right? Even many of the hospitals have what we call general physicians who can become family physicians. Particularly as you get older, there are multiple ailments at the same time. My mother had gastric issues, she had COPD, she had, digestive issues. And if she ever went to the hospital, or every specialist would give her a lot, different medicines, and you do need somebody to manage that, because everyone is doing their bit, but who's going to look at the patient and their condition? So it's unfortunate that general physicians are becoming less, but there are, right? People who say we are internal medicine are actually, in a sense, general physicians. And this category of people are coming up, somebody who's trusted and nearby you. So do find one, rather than all the time being going to. And the advantage of a family physician is they know your history, right? So they're able to correlate what's happening to your children, and that goes on through the journey. So I think you'll be able to find one, though the breed is lesser. Thanks. I think Sushma,
there is one more from Robin Sarka. The closest hospital is not the best. The better one is little far away. How to decide where to go in an emergency given Bangalore traffic?
Yeah, so if, that's always a dilemma. So if you had a snake bite, go to the nearest. If you had an accident which you're not bleeding and you just want a fracture or something, if it is an emergency, and that is why we are saying know the symptoms. And I did speak about those symptoms. In which case, the nearest hospital is good enough for minor emergencies, etc. We have had cases of somebody falling, bleeding. The driver took them to the nearest hospital. The hospital says, I can't deal with it. They had to go to Manipal. This is happening in Bangalore. I think they wasted 50 minutes. Unfortunately, this friend of ours, this lady friend, she went into coma, never came out of it. So if it is an emergency, I would still say, even if the hospital is little further, but, let's take, I think when the hospitals are also coming closer and closer to you because they think it's a marketing too. Not everybody has to travel to, say, from Banarkata to Airport Road at Manipal. I guess you have a Apollo somewhere nearby or some other hospital which is closer by. So the question is, do you know that place nearby, right? And maybe the institute can help do this, right? Of saying, good, these are the people we have tied up with. But at home, where your parents live, I think that little homework, I think, would help.
Thank you. We have one more from Biswajit Roy. He's asking for vaccines for above 40 years of age, which we can consider.
Nadira, you want to take that?
We do have a list. We do have a list of vaccines. Okay. I think that's there in the poster. Let me send it out to you. It's pneumonia, definitely. And influenza. Okay. Can I just mail it to you instead of just saying verbally? Can I just add it up? I'll just add it up in this chat. But we do have it for adults. We have it for women, we have for children, and we have for adults, both.
Yeah, and to add to what Nadira said, there are some that are required every year. There are some that are once in a lifetime. There are some which are once in 5 years. And I think, as I said, I'm repeating again, it is risk management. Vaccines are risk management, right? You do everything else, right? Just take care of your life and take care of your family's life by doing this risk management. Insist, for example, your parents need herpes shot, because today people above 60 are getting higher incidence of herpes, which is quite devastating, and you can prevent it.
Shingles is the latest one, yes.
Yeah. Okay, any other?
There is one in the chat, sir. From Rakhal. Need some material or advice about how to handle emergency in smaller towns when a good doctor or a good hospital is not within at least 2 hours.
Yeah, I think this is a big issue. Healthcare starts deteriorating as you get further and further away from. So one thing is about vulnerability, right? Every emergency has a vulnerability, right? We know that people are more vulnerable to the others. So if you do not have a good hospital nearby, I think you have to fix areas where sometimes your parents are getting checkups done, etc., because then you know what their vulnerability is and address this. There is no easy answer. The only thing I'd say is that, it is an industry now. It's no longer about, free hospitals and free. So more and more hospitals have started coming up in tier 2, tier 3 cities. Organization like Manipal, I'm not sure how many hospitals they have. I know for sure for Apollo, they are now getting more and more into tier 2 and tier 3 cities to start up hospitals. By the way, I just also mentioned that even sometimes in tier 2 hospitals where you have, I can tell you the amount of use of air ambulances that is happening, and it may not be available in a smaller town, but air ambulances are also helping out getting them to even more super specialty hospitals, fly them in. We all have worked hard, saved money. I think the only time you would need to be spending that money is hopefully that you can ensure that you get the best healthcare.
Can you all see this list?
Yes.
Is this list visible?
Yeah, it is visible, but not the full. I think it's.
थोड़ा सा बड़ा कर दो इसको. Varsha, just increase the size. These are the vaccines for ages 19 to 65 years.
Just scroll it. Scroll it.
Okay. So what's wrong? Influenza is annual. Pneumonia is once in 5 years. Herpes or shingles is once in 10 years. Tetanus is a must, 10 years. I would say even earlier. Typhoid once in 3 years. Cervical cancer, HPV is once. I mentioned that earlier. And jaundice, which is hepatitis A or B. It's a set of doses. You have to there's a set of 2, set of 3. And that is, you take it once and it's for your lifetime. But keep an eye out open for new things that do keep happening again and again. I would also like to answer to the response in the smaller places. There are 2 things. Number 1 is the first aid kit. Varsha, please display the first aid poster we have. Kindly keep a ready first aid poster. I'm just showing that to you. There's a lot of material in this, and this can save an immediate or mitigate risk or reduce complications if you have things like that. This is sterilizing. This is immediate washing. This is preventing infection. These are bandages. These are medicines. They look elementary, but if you have clean, sterile, ready-made available, this can be your first point of attention. But also telemedicine is now available as a facility for the interiors, including the primary health centers, which are the grassroots level healthcare people. There is a lot of training going on even for the ASHA workers, and it's a hub and spoke model. There's an e-Sanjeevani, which the government runs, and there's an ADBH, which is Ayushman Bharat Digital Mission, which is for health. There is an ABHA app, Ayushman Bharat Health Account, which people in the interiors can enroll in. It just needs a couple of clicks with your Aadhaar card, and you will be able to access healthcare from a district civil hospital, who will contact the primary health center, and they will impart the immediate SOS trainings. There are specialized NGOs are doing this, but the government is also doing this. So keep in mind that the government facilities are also available. We don't have to only depend on private sector. As I said, there are NGOs who do particular areas, but in overall, we've got lots. So we've got lots of this material. For eyes, for feet, for dental care, for skin care, for women's health, for anemia, for cancers. Please do come forward and send us your names if you're interested, the company name, the point of contact. I repeat, we are not charging anything. We will send you the material on a periodic basis. You send it forward. It is both pictorial as well as text. We're coming up with videos, both audio and silent versions. So please share it. It's there to take it. Just enroll and just click and you get it. And the point of enrolling with us is that you'll get a periodic updates, because we're coming up with more and more. So these are our answers, and this was just a glimpse of our inventory, but there's much more happening in every language, by the way. We have a very robust website. Do visit it, and keep sending us your questions as well. These are good questions you asked, and we're making a note of it so that we respond to it for everyone's purposes.
Yeah, thank you, ma'am. I think we don't have much questions. Are we having any questions? If you, I think mail ID is given, and all the links are given. So if you can.
This is for the Bangaloreans in the Kannada, Namma Nadu, Bengaluru. That's where it is. Yella Aramaita. That's where it is. No, but it's not only Bangalore, there's everybody here. So I'm sorry. We've got in Marathi, we've got in Gujarati, we've got in Punjabi, everything.
So thanks, Sushma, for arranging this. And I hope we can, ensure that we keep providing, find whatever way that you can to share this with alumni, with students, etc. As you all saw, it's not for people in, who are senior in age. Of course, they are more vulnerable, but it's all of us. We are no doctors. We are just like you, but we have now seen it with experience. And that is why we are spending this time, effort, working with the hospitals, that we can reach it to you in a very simple, understandable language. And we will still advise, like in case of the vaccines, show it to your physician, and he will be able to tell you which ones to take first, etc. Right. So on that note, thanks, Sushma, for arranging this.
So on behalf of our office, Alumni IIM Bangalore, I thank everyone for joining, and also Mr. Mittal and Nadira. I think Ms. Nadira for putting up so much information, and I think it's very helpful. I think some of it we know, but we don't act. So
okay. So you can share the recording with everybody who has registered.
I think the recording will be uploading into our YouTube. It's called IIM Alumni Webinars channel. I'll also share with you also. Okay. So you can go back and check, and also the links are here, and anything you can please mail us, and you can update, subscribe to the newsletters, everything.
Thank you all. Remember, one word before you go off, please say after me: my health, my responsibility. I want everybody to repeat: my health, my responsibility.
Can everybody unmute? 1 second, let me.
Okay, let's see.
They are not able to, I think.
So just remember, my health, my responsibility, and you'll be there. That's right. My health, my perfect. My health. Praveen Kumar replied. Thank you, Praveen. Okay. All right.
Okay, ma'am. With that, Thank you.
Thank you, Sushma. Thank you, Ms. Utanka. Thanks.
Thank you.
No.